Unmute, Pastor.
And so we try it again. And again, I say welcome to Morning Star Community Christian Center Church's Life Study. Life Study. We'll get through these hiccups as best we can. And every Thursday evening at 7 p.m., we have a life study. And as you know, the Bible is the foundation of our life studies, and we study the Bible to help us make our lives better to the degree that we can align them with the Word of God. And so we always remind ourselves of the importance of the life study by holding up our Bibles or the digital devices on which we have our Bibles, and we repeat these words. This is God's holy word. Receive it, believe it, achieve it. And this evening, the foundational verse for our study is found in Genesis 50 and verse 20. And it says, as for you, you meant evil against me, but God meant it for good, to bring it about that many people should be kept alive as they are today. These are the words spoken by Joseph as he spoke them to his brothers as he revealed himself who he was to them, for they were unaware. And the point of this is that Joseph, like Esther, like Nehemiah, were all strategically placed in positions that allowed them to be helpful to and to help save God's people, their people. And just like that was the case then, and they were all, Joseph was seated in the palace, Esther was seated in the palace, Nehemiah was seated in the palace. And this afforded them access to the seat of power, the seat of authority, the seat of supplies, the seat of knowledge. And this afforded them the opportunity to access all of this to be helpful to their people, all according to the will of God, who strategically placed them there. And we have people today who are strategically placed in positions of knowledge, positions of influence, that I believe are strategically placed to be of help to our people. And today we talk about, again, the coronavirus. And backed by popular demand is Dr. Stacey Mary Taylor. She was our guest last week, and we had a wonderful program, extremely informative. And she's back this week. And we have two other guests with us as well, who will provide some insight, not only into the virus, but the vaccines and the vaccination process, which, as you know, is ongoing. And so immediately, I want to welcome back to the Morning Star Community Christian Center Church's broadcast, Dr. Stacey Mary Taylor. Dr. Taylor, welcome back again.
Thank you so much for having me again, Pastor, to once again talk about such an important topic, so relevant to today, the coronavirus, as well as speak on the COVID-19 vaccine. I am lucky enough to have two very close friends of mine who are also physicians, but who have taken the vaccine already. And the first is going to be Dr. Lee Vaughn. Dr. Vaughn is coming to us from Charleston, South Carolina, where she is, hello, Dr. Vaughn, where she is the program director for the Palliative Care Fellowship. So thank you for joining us. Dr. Vaughn and I go way back, and she is a good friend as well as a mother. And I thought that it would be great to hear from another physician who is a little bit different, in a different situation than what I'm in, because Dr. Vaughn is in South Carolina, where the cases are fewer than the cases here in New Jersey and New York, and where some people actually don't wear masks, and some people don't believe that coronavirus is real. So thanks for joining us and giving us your opinion and your point of view about the coronavirus and the COVID-19 vaccine, Dr. Vaughn. So
thank you for having me.
Yes. So can you tell us what the vaccination process was like for you, and as well as what your personal process was for deciding to take the vaccine?
So thanks again for having me. Forgive me if there's an echo, but as Dr. Murray Taylor said, I am a mom, and I got the surprise, you're driving to hockey tonight. So I am at the hockey rink, but I found a place that had a little bit of light. And so thanks again for tolerating the echo. So, the coronavirus, the 2 vaccines now approved for emergency use are the Pfizer vaccine and the Moderna vaccine, which was just approved today. And so Pfizer rolled this out on Tuesday, and I was able to be immunized on Wednesday. I have no explanation for why South Carolina, with fewer cases, and I already have been vaccinated. But how I know the decision-making process is in our state, because it's going to vary state by state, is that they went for first-line healthcare workers with patient contact. And so throughout the whole pandemic, I am a palliative care physician. And so what I have been doing is taking care of patients with COVID who are at the end of life. And Dr. Murray Taylor asked me what was my motivation, and I think it is always your own personal viewpoint. So what I have seen for the last 9 months is COVID patient after COVID patient, where I'm the one holding their hand at the end of life, as opposed to their family members. And so when the opportunity arose that I could be vaccinated in the first wave, I went for it. And so I had my first shot on Wednesday, and I would say that I had no side effects at all. And the plan is to get the second vaccine anywhere from 19 to 23 days after the first. And I hear that there are a few more side effects with the second shot, but I had essentially no side effects with the first shot.
So your process in deciding to take the vaccine, did you talk to family, friends, or did you know from the moment this vaccine got approved that you were taking it?
I didn't know from the moment I first heard about it, because, I found this year to be a year with unprecedented mistrust of institutions that I have never questioned. So I've never in my life questioned the CDC, but some of the politics of this year made me wonder if there were any commercial interests, any political interests that were driving this vaccine. And I was honestly quite suspect. Where I think that I have turned my decision-making around is the endorsements that have come since initially hearing about it. So I'm fortunate that I work in an academic setting, and I get to share office space with the infectious disease team. And they, I speak a little bit of the language, but I am not an infectious disease doctor. And I don't think I understand the 2,090-page document that went before the FDA, but my colleagues do. And they said, this is really solid science and this is great news. And then it was endorsed by people that I really respect. So, as we were joking in the sort of sound check, I'm Team Fauci, but actually that endorsement really means something to me, because he said, I'm going to get it for my own family. And he's somebody who has not bowed to the politics of this year. And then the third thing is just this, seeing the efficacy behind it. So a 95% efficacy is pretty stunning for a vaccine. Hearing the process and the careful consideration in which it was made me say, well, I can be fearful about the unknown. Like, what are the long-term side effects? I can be fearful about that. But the thing that is known to me is what COVID does. So I see it every day. I see patients die from it. I see long-term side effects of COVID. And that part is more certain to me than the uncertainty of a new vaccine. And so I just weighed the two.
Well, thank you. Thank you. What would you say to people who may be hesitant about taking the vaccine?
Yeah, I think that that's the exact population that is the most ravaged by COVID. In South Carolina, there is a tremendous history of mistrust, of mistreatment, of patients of color. There is a tremendous, this is, as I say, I moved from New York City. This is not New York City. So the folks who have less access to medical care, who have more comorbidities, they're the ones who are getting the sickest from COVID. And that's the population that I think is also the most mistrustful of the health system. And it seems to me like the perfect storm. So it's the most vulnerable patients who are also the most distrustful for the healthcare system. And so other than saying, I think the science is solid. I think what COVID does to patients and patients' families has really played out these whole 9 months. That's the part that we know, is that this is a terrible virus that if we do nothing, as we have done for 9 months, it's going to continue to do what it has been doing. And so I think that doing something markedly different is the only way that we will get a hold of COVID. And I feel fortunate that the science, in 11 months from the first case to the first immunization, that is a stunning achievement. And so what I hope is that all people who have felt disadvantaged by the healthcare system take full advantage of this really remarkable step.
Yes, thank you.
Can I step in, Dr. Mary Taylor?
Absolutely, please.
First of all, Dr. Vaughn, thank you so much for agreeing to be with us this evening. We're glad to have you. And you, you're at the University of South Carolina. Is that not in Columbia?
So the University of South Carolina, the undergrad is in Columbia, but the medical college is in Charleston.
In Charleston, okay. So that and South Carolina has a fairly substantial population of people of color, people of African descent, and I would imagine that they constitute a fairly significant proportion of the patients as a part of the demographics of the hospital and the university hospital setting.
Absolutely.
Okay.
This is the Gullah Geechee community, which, 40% of all slaves were traded through the port of Charleston. So, I'm sort of sitting right in the middle of an extraordinarily complicated, difficult, and painful history, and specifically my university has really done significant damage to communities of color. And I think this is an opportunity for disadvantaged communities, for underrepresented communities, to take advantage of first-rate science.
And have you noticed, have you heard from some of the patient population there, this actual reticence, this hesitation? Has that been verbalized to you that, I don't know if I want to take this, I don't want to be used as a guinea pig? Have you actually heard that from some of the patients there?
Absolutely.
Yeah.
And what I have also heard is that that's the group that I'm taking, you know, as a doctor who takes care of only people at end of life. I am seeing our COVID population at the end of life is significantly higher people of color than the larger population. So it's the most affected by the virus, but yet also the most reticent to take it. Understandably, we have a very painful history here of guinea pigs, of not being forthcoming, of patients not even today getting equitable healthcare in South Carolina.
Good. Okay. Thank you. Dr. Taylor?
Wonderful. Yes, thank you, Dr. Vaughn. And please, if you'll stay on, but I'd like to introduce Dr. Dixon, Dr. Trevor Dixon, who is also a friend and colleague of mine. Dr. Dixon is the director of emergency ultrasound at Jacobi Medical Center in the Bronx, New York. He is also the father of four and the founder of Jaja Foundation, which stands for Jamaicans Abroad Helping Jamaicans at Home, where they provide medications, medical training, medical equipment to Jamaica, underserved populations in Jamaica. So thank you, Dr. Dixon, for joining us. He is an emergency medicine physician who also has taken the COVID-19 vaccine as a frontliner. And so Dr. Dixon, welcome.
Thank you. Can you hear me?
Yes, yes. I know you have to work a shift tonight, taking care of patients, and we thank you for your service. And I know you only have a few minutes. So during the brief amount of time that you have, if you could, I'm just going to ask you some of the same questions I asked Dr. Vaughn. If you could just walk us through what the vaccination process has been for you, as well as your own personal process of deciding to take the vaccine.
But first of all, Stacy, thanks for having me on. You know, you've been a long time mentor of mine. So thank you for mentoring me for all those years. And it's a pleasure to, you know, it's an honor to be interviewed here today. Thank you.
Thank you for coming.
Yes. As you know, I work in New York City, and this is referred to as the first epicenter. Of course, California now is another epicenter, but New York City was kind of like, as the Reverend would say, we were the guinea pigs, you know, so almost like the canary in the gold mine. So we got hit pretty hard in New York City. I work in the Bronx, New York, which is, we have different boroughs in New York. You have Bronx, Brooklyn, Queens, you know, Staten Island, and Manhattan. So you find that the outer boroughs, Manhattan being the center borough, the outer boroughs like Brooklyn, Bronx, and Queens, and those actually got hit the hardest as far as the New York City areas. And it's no surprise that's where most of the minorities, or what they call the brown people, that's where the more concentration of brown people live. Manhattan, you have a higher concentration of Caucasians, and the outer boroughs you'll find more minorities, and that's no surprise that, you know, in the outer boroughs where the density is greater, you know, more apartments, you know, people live closer together. People take elevators to go up into the building, you know, and go into the bodega to get something to eat. So you're gonna, you know, you're at higher exposure rate than some place where the landmass is greater, like, you know, like other states, like, you know, you would think like Nebraska and those places would have a lower number. So we knew why we got hit. And in the first months, March, April, we saw like every patient we saw in the emergency room was a COVID patient. There was no COVID room because the whole emergency room was what's called a hotspot. Like the machines, the computers, the blood pressure machines, everything was pretty much, we knew was COVID infected because the concentration was so high. And back then they were telling you that COVID could live on the surfaces. Some people were saying 4 hours. Some people were saying 24 hours on plastic surface, less on metal surface, or more on metal surfaces. So it got crazy. It made you really very paranoid. You went to work and they gave you a gown that traditionally those gowns you would change between patients. they're telling you now wear that gown the whole shift. So, and as Dr. Vaughn, who was on earlier from South Carolina, said, we had no real leadership from the CDC and even the FDA. We also often felt as if like it was a political pawn for President Trump to just, kind of manhandle the CDC and tell them what the new guidelines are going to be, and pushing certain medications. So it created a lot of mistrust, which we understand, to the community. So this is where we are now. I don't want to keep talking. Stacey, how am I doing?
You're doing great. If you could just tell us, what was the process that you decided to be one of the first people to take the vaccine? Why did you decide, I'm going to take this?
Well, to be quite honest, those always become like a personal issues, where people decide to take the virus, yes or no. And I had a lot of, for the past, since March, I haven't had a vacation. I haven't had really a day off. I have 2 young boys, and they're in school doing virtual. So there's really no days off. And I work in still a very COVID environment. And every time I go home to my child, the 2 boys, and the rest of my family, I'm saying to myself, am I bringing home COVID today? Is it on my clothes? Is it on my breath, even though I wear a mask? So just the fear of knowing that I could at any day be infected with a COVID vaccine, and I'm bringing it home. And you can't tell kids that, that they want to hug, they want to kiss. You can't social distance from your kids for too long, because there's this natural bond that we have with our children. So understanding the science behind messenger RNA. I mean, every physician, in medical school, you learn about the messenger RNA. So we understand how it works a lot better than maybe the lay population. So we are less fearful because we understand the science behind it. And we know that, based on the science, it's actually the technique of making this virus is actually safer than how they made viruses before. In the fact, in the past, they would take dead portions of viruses and actually incorporate it in vaccine. This doesn't take any dead viruses. It's actually a synthesized strand of RNA, basically. And then it's used that and enters the body, and the body makes proteins based on what we told it to make based on the RNA strand. So we understand the science a little bit more. So we understand why the lay population, they're hearing stories that they're going to have 2 heads. They might start walking like a dog, or walking backwards, or even just dying. And people, are fearful that, this virus is going to make them sicker than how they were before. And we know that it's virtually almost impossible for it to make you sicker than you were before. And if you look at the death rates in the hospital, and people who just come in and for unknown reasons, they're succumbing to this virus, and you can't do anything except give them supportive care and hope for the best, honestly, because a lot of these medications don't work. So I knew that a vaccine, I've taken vaccine, this is not my first vaccine. I get my flu vaccine every year. So I'm like a regular vaccine getter. So I can compare this vaccine to other vaccines that I've had, and it's no different. It feels no different. My arm doesn't hurt, but if I move in a certain position, I could feel like, oh yeah, I had a shot today. But it's nothing it's not a continuous pain. It's something that if you don't think about it, you won't remember that you got the shot. And then as soon as you move your arm a little bit, it may feel a little bit sore. And everybody has a different experiences. I don't have any rashes. I don't have any bruising or anything like that. I'm not on blood thinners or anything like that would increase my chances of bleeding. So I'm pretty comfortable with it. I took it this morning, and I was up for about 16, 18 hours before I took the vaccine. So I was already tired. So my immune system was really suppressed. But I woke up, I slept, and I woke up, and there was some anxiety, of taking a shot, but I'm fine now. I woke up, I feel like my normal self.
So what would you say to someone who is reluctant to take the vaccine, or who's hesitant? What would you say to them?
I say, I can understand everyone's hesitance and fears. African Americans, in particular, Blacks. We know we've been used as guinea pigs for many years by the health system. Almost every major university center today, it's where they are because they experimented on Blacks and write all these wonderful research papers, get all these Nobel Prizes, and what do we get in return? Nothing, just an abuse of the community, and that still continues until today. So this is sometimes people's way of lashing back at the system and saying, no, you're not going to just have me sign up for some for some vaccination. No, I don't trust you. No, you're not gonna. It somewhat makes you feel empowered when you don't have to do something that somebody's telling you to do. But I say the reason why I got this vaccine was for my family. Just knowing that I could, inadvertently infect my father, who is 97 years old. I haven't seen him in 9-10 months because he's 97. And you get the feeling, he's not as strong as he used to be. You get the feeling if the wind blows the wrong way, that could be his day. Could fall and break his hip. Anything can happen. So, it's concerning for me. I talked to my father on the phone, and he says he's lonely. And he's 97. Of course, he's lonely. So, and I feel helpless because I know at any point, if I don't get the vaccine and if I don't, increase my immunity, I can go to Jamaica and look for him. But it may be the last time I see him. If I go to Jamaica and 2 weeks after I visit him, my father passed away. There's no way you can't tell me I didn't infect him with the COVID-19 vaccine. So I did it for my family, not so much for me. I did it for my kids, and I did it for my family to keep them safe. And I took the vaccine as an example, as an African American who is not afraid to try something that can actually make a big difference in the world that we live in now.
Well, thank you. Thank you so much. I know you have to go to your shift, so thank you for spending some time with us. So
Thanks
for
having me. Thanks for having me.
I'm not sure, Pastor, if you have any other questions for
Dr. I just want to thank Dr. Dixon for being with us and for sharing with us. We have a lot of people from Jamaica at the church. And let me just thank you for the work that you're doing in Jamaica as well. And I'm taking from what you're saying that you would recommend that people of African descent take the vaccination when it becomes available. So the rest of us, our number is probably somewhere around 313 million. So it's going to be a while before it gets to us, but you're saying you recommend that we take it.
I'm saying yes. I took my vaccine this morning, and there were mostly Caucasians there who were getting their vaccination. So I don't want us to miss out on this opportunity to at least give us a fighting chance in this this very hard world that we as African Americans have to navigate ourselves through every day. So this is vaccination. I think is a good thing. I say yes. You can get the vaccine, and I can come on, at some other point so you can see I didn't grow another head or extra eye or anything, or I'm healthy. So thank God for that. And Pastor Evans, thanks for having me on, and Stacy, thank you for having me here too.
Thank you for coming, Trevor. Have a great shift.
All right, love you. Bye-bye.
Love you too. Bye.
Be safe. So, Dr. Taylor, thank you so much for inviting Dr. Dixon and Dr. Vaughn, and I believe Dr. Vaughn is still with us. This is too wonderful. Now, did you have something you want to say, Dr. Taylor, before we go to questions from our listening and viewing audience?
I just wanted to I know Dr. Vaughn touched on it, that the Moderna vaccine was also today found not to have any significant safety concerns. And so we anticipate that in addition to the Pfizer vaccine, will also be approved for emergency use, EAU, EUA, emergency use authorization. And should be available probably starting next week, we anticipate.
Wow. So let me remind those of you who are viewing and listening to us at this moment in time that you can begin to line up, queue up with your questions. Go to the chat room and indicate what your question is. We'll get to as many of them as we can, and prayerfully all of them, but we want you to have your questions answered. That's why we are doing this, and that's why this is part 2, because of your interest. So if you have a question, go now to the chat room, surface your question, and we will get to, as I said, as many of them as possible. So now we have Dr. Taylor and Dr. Vaughn. You can come on back and join us. Now we have two viruses that I'm sorry, two vaccines that have been approved for use. Now, does this mean, therefore, that the time it will take to get a substantial proportion of the population vaccinated is now shortened? Or does it make no difference in the time it will take to vaccinate all of those that we'd like to see vaccinated?
I think there is still going to be some time before everyone is vaccinated. I think that the Pfizer vaccine is expected to produce Pfizer is expected to produce 50 million vaccines, and Moderna is expected to produce 50 million, and Pfizer is expected to produce about 20 million vaccines. So there's still a long ways to go to be able to have enough vaccine for everyone. But I think it is going to make a little bit of a dent in the population and people who would like the vaccine. There's another vaccine that's on the horizon, the AstraZeneca vaccine, which has a little bit less efficacy. It's been found that it may not provide as much coverage as the Pfizer and the Moderna vaccine. However, that vaccine, they anticipate to have over 200 million doses of that. So if that gets approved, then definitely we will have a lot of vaccine that we'll be able to really effectively vaccinate a large part of the population.
And one thing to know is that they have put an outline of phase 1, phase 2, and 3. Phase 1 is essentially healthcare workers and frontline workers. Phase 2 is the one that seems to be the most not clearly defined, muddy, if you will. It is patients with heightened comorbidities. And that's the one where I have encouraged my patients to advocate for themselves, because comorbidities can be a wide range of things. It can be patients with diabetes, patients with lung disease. It can be a wide variety. And I think having a strong voice in the advocacy group would be something to know that population has not been clearly defined. And so if you were in the group of comorbidities, maybe you have to speak for yourself. But hopefully we can get all the people that need it as quickly as we can.
Okay, thank you for that. So we're talking with Dr. Stacey Mary Taylor, who is the medical director at the Overlook Medical Center. She's the medical director of the Union campus of the Overlook Medical Center. And we're also talking with Dr. Lee Vaughn, who is at the University of South Carolina in Charleston, South Carolina. These are our two guest experts this evening. And if we are about to go to your questions, so if you have one, please go to the chat room. Let me bring it, Brother Terry, are you there? And do we have a first question for our guests?
Yes, we do, Doc. This question comes in: can you explain herd immunity as to what Donald Trump allegedly was pushing for versus the science of how immunized herd immunity works?
Well, that is a complicated question, and I will do my best to take a stab at it. I am not an epidemiologist or an infectious disease doctor, but I will try. And Dr. Vaughn, and Dr. Dixon, I believe you're on as well. If you guys have anything to chime in, please do. So herd immunity speaks to having a percentage of the population that has either received the vaccine or has had the disease so that they have antibodies and that they are protected. So that number is believed to be at least 70% of the population to have either had the disease or to have been vaccinated. So they have antibodies. So they are protecting themselves and therefore spreading it less and therefore protecting the population as a whole, the whole herd, so to speak. And that can come in a few different ways. That can come, like I said, either via having the infection, where certain countries have decided that they were not going to really enforce closing down the country and basically letting the virus spread as it may, infecting as many people as possible. Therefore, those people would develop immunity and not be able to pass it on to others, and thereby protecting everyone. So that is the essence of herd immunity. What was the second part of that question?
The science, like the science of how immunized herd immunity works versus what Donald Trump was talking about.
So I
yeah,
actually read a little bit on this today. So I think what there was some information that came out from the Trump White House that said that they were suggesting to let the infection, like to actually let it infect as many people as possible, so that those people would then therefore develop immunity, and that would raise the number of people who had it, thus lowering the likelihood of infection spread. That has been widely criticized, debunked, called just flat out crazy talk. Because what that means is sacrificing patients as opposed to doing it the way that we do other diseases, which is prevention. So allowing as many people, the vulnerable, the elderly, to get sick so that the healthy people can benefit is just absolute craziness. And so in every other disease process, we don't let that happen. We used to, way back in the day, do that with chickenpox. But what we found when we really carefully studied it is even though it's not a lethal disease, the amount of morbidity and suffering and lost time at work and complications can be prevented. So even something that seemed as benign as chickenpox, which COVID is not, we have learned from our mistakes, which is you don't let healthy people get a preventable disease.
Exactly. And to add to that, I think the herd immunity of letting people get the disease was, I think Sweden looked at trying to do that. And what they have found 10 months later is that it doesn't work. They have now shut down their bars and restaurants, and they have really taken to asking people to wear masks and staying socially distanced and doing everything within their power to prevent people from getting this disease, because death is associated with this disease.
Yes. Okay. Thank you very much.
I think
Brother Terry, next question.
Okay. This question comes in: is it a yearly vaccination?
So right now, I think it's still a little early to say. We're still learning about the vaccine. But from what I have read and what I know is that the vaccine is expected to produce some long-term immunity. So there is an initial vaccine, well, with the Pfizer and the Moderna, there's an initial vaccine followed by a booster that's 21 days later. And right now, the belief is that we probably will not have to have it annually, but that still remains to be seen.
So I remind you again, we're talking with Dr. Lee Vaughn from the University of South Carolina in Charleston, South Carolina, and Dr. Stacey Mary Taylor who is here at Overlook Medical Center, and she's the medical director of the Union campus. And we're talking about the coronavirus, talking about COVID-19. And if you have a question, please line up in the chat room, and we'll get to as many of them as possible. I have a quick question for both of you before we go to our next question, and that is your feedback with regard to the wearing of masks and social and physical distancing in the context of vaccines and vaccinations being now available. Should people now, or can people now, give up the whole idea of being socially distant and wearing of masks, because now we have the cavalry has come vis-a-vis vaccines and vaccinations?
Well, yes, we should still wear masks and remain physically distanced from each other and keep our hands washed for a couple reasons. One is this vaccine was studied in the context of wearing masks and being distant. So the efficacy of the vaccine has not been studied in people who do not wear masks and do not remain physically and socially distanced. So the efficacy of 95% is known in a population that also wears masks, wash their hands, and stays distant. So that's part of it. The other part of it is that the vaccine is believed to prevent, but it is not 100%. So therefore, some people may still get the virus, but what we've found is that the virus is not as severe and not lethal in people who have received the vaccine. So people still can get coronavirus and they can still pass it along even if they've had the vaccine. So therefore, it is important to stay distanced and to still wear a mask even if you've had the vaccine.
Okay.
Dr. Vaughn, anything you'd like to add?
Yeah, it's going to take a while. So if there are 3 phases, the third phase is, if frontline healthcare workers and frontline workers are phase 1, people with comorbidities are phase 2, everybody else is phase 3. And that's going to take a while. And so I'm going to wear my mask and socially distance until everybody is vaccinated or until we have herd immunity. And it's not going to be forever. We're going to travel again. We're going to hug. We're going to have weddings. We're going to do all of those things. But right now, it's a small sacrifice for the greater good.
Thank you for that. Brother Terry, next question.
Do you still need to take the flu shot if you have taken the COVID vaccine?
Dr. Vaughn, you want to take that one?
Please get your flu shot. That one you need every year. Please get your flu shot, because what we cannot have is people dying from the flu and COVID at the same time. There is no ICU bed in California, none. And people still die of the flu. And so, all our focus has been on COVID, appropriately so, but we cannot afford ICU admissions with no ICU beds and no ventilators. And more importantly, no nurses and doctors to take care of those patients. So the flu shot, as we've known, is not perfect, but those who get the flu, who've been vaccinated, do better, and it does prevent deaths.
Anything to add, Dr. Taylor?
I think she said it all.
Okay, so before we go to the next question, and please light up in the chat room if you have a question. Dr. Vaughn, Dr. Taylor, is it accurate to say that the efficacy of the normal flu shot that we take, is that the efficacy there somewhere around 65, 70, 75% as compared to the 90 to 95% efficacy of the current Pfizer and Moderna vaccines.
Absolutely, Pastor. You said it. Many people will take the flu shot without so much as batting an eye. And like you said, we're talking 60 to 75% efficacy versus something that we know is 95% efficacious. So it's just simple math there.
Yeah, okay. I just wanted to get that point out there. Brother Terry, next question.
Okay. Since this is round 2, I'm going to go ahead and give this question to Dr. Taylor, but I'm almost positive we answered it last week, Pastor, but maybe the person missed, so we'll give this another shot. Can you give an overview of what self-quarantine at home should look like?
Sure, absolutely. And I have no problem giving this information out again because it is so important. Quarantining means that you should not see anyone else face to face. When you self-quarantine at home, you should go home and you should be in one room with the door closed. Your family members and friends should not come visit you, should not come sit in the room with you. You should not go to your family room and sit and watch TV or to your kitchen table and sit and have dinner. Your family should bring you your food to the door with the closed door. Once they leave, you can open the door, bring the food inside, and close the door back. If there is only one bathroom available for the household, then after you use that bathroom, it should be wiped down and sanitized with bleach before you go back into your room and close the door.
Before we go again, if you have a question, go to the chat room, surface it, and we'll get to as many of them as we can. Any evidence what does the science say about the surface life of this virus? Can and is it spread efficiently, effectively, or at all by touching surfaces that someone with the virus has touched?
Yes, we do believe it is spread by touching surfaces that others have touched. We think a lot less so than we thought initially when the disease first started. But yes, it can still be spread by touching those surfaces. That's why hand washing is also very, very important. Touching glass, touching metal doorknobs, where the virus is believed to be able to live for an additional 4 to 5 hours, you can get infected by touching those surfaces and then touching your face afterwards. So yes, it is still living on surfaces. It is still being spread by surfaces. So keeping those areas wiped down and cleaned is very important.
Okay. So that if you got a package from someone, or maybe it was delivered by someone, and let's say they had the virus and they didn't know it, but they delivered a package. If you left the package on your front door or in your mailbox or on your porch for a day before you took it in, of course, that's one way to do it. You could also take it in and wipe it down. But what if you just left it there for a day or several hours? Does that provide you necessary protection, or should you be taking other precautions?
I really think that leaving the packages for a day really would provide significant protection. And this is just from what I've read and from things that I've listened to. But still, bringing those packages in, and then the advice right now is to, if you bring those packages in your house and you put them on the counter at the end of the day or later on after you've removed the package, to wipe down the counter and wash your hands.
Okay.
But I would add, Pastor Evans, in the beginning of the pandemic, where it was sort of toilet paper and alcohol wipe Armageddon, and we couldn't find anybody, and everybody was wiping down their groceries and wiping down the UPS packages. We spent so much time doing that we really failed to do the things that matter the most. And the infections that I have observed are from family interactions. And so I think take your packages in, but stay away from family that you're not in a bubble with. And, even my mom said to me just this past weekend, but I'm just going with, my friends that I see all the time, or I'm just going to go see my niece. And it's the niece and the friends that you see all the time. That's where we're getting more infections. I'm not negating the UPS packages and the surface, because I think we have to be vigilant about washing our hands. But I think what we have to be more vigilant about is our friends that we think couldn't possibly have COVID.
Yeah.
I agree. And that being said, really, if you don't live with someone, you should have a mask on when you see them. Your mask should really only be off when you're in close contact with those that you live with. If you're around people who you don't live with, you should really have a mask on.
Yeah. And are we not right now experiencing another kind of spike from the Thanksgiving holiday? When people were in close contact with, I guess, family members and friends that they are not bubbled up with. So, well, Terry, do we have another question for our guests?
Yes. People say we have been waiting for years for vaccines for cancer, HIV, the common cold, diabetes, and other diseases. Can you please explain the difference and lay this to rest as to why the vaccine for COVID-19 was developed in this short span of time?
Well, like I said, I am not a virologist or an epidemiologist. Well, one thing I do know is that the HIV virus is very complicated. Some viruses are complicated, some viruses are not. The HIV virus is very complicated. And to my understanding, that virus, once it enters your body, it mutates inside your body. So you not only have to develop a vaccine that stop the virus, but you have to develop a vaccine that can continually adjust itself to continually contain the mutations. And until that's done, I think an HIV vaccine is not on the horizon.
And those other diseases, cancer and diabetes and heart disease and all the other diseases that affect so many of the people that we love, because they're not viruses, we can't, or simple viruses, that we are not going to be able to do a vaccine. And so I think we cannot ignore the political pressure, the weight of the world on the scientists. And I do think that boundless money and high motivation did make for a quick return. But I try to see that as a good thing as opposed to something sinister. And I concede that I had some real doubts at the beginning, but I think that the science behind it is really strong.
Okay. Well, we are approaching the end of the hour, and we try to keep the program to no more than an hour because everything today is on Zoom. So, and we know that people are zoomed out. So I'd like to maybe ask you, Dr. Vaughn, and then you, Dr. Taylor, to give some kind of summarizing, closing statement or inspiration or word of advice for our listening audience that you'd like to leave with them that you think is extremely important that we pay close attention to. starting with you, Dr. Vaughn.
All right. Well, thanks for having me. It's been an honor to talk to y'all. And what I really hope is that vulnerable patients are the ones that are at the head of the list. And instead of seeing it as being guinea pigs, which historically it has been, I hope that people instead have the faith in the scientists that this is the only way forward out of this disease, because in 9 months, it's not shown any sign of giving up. And this virus continues every day. It's more people than died on September 11th, every day for the past week. And me as the only person at the bedside having other people Zoom call their mom, it's just been too many people. And if we have a way out of this and a way forward, I am hopeful that people will take it along with me.
Thank you. Thank you. Dr. Taylor?
I would just like to say thank you again for having me as well. And let's continue the dialogue, the conversation. Let's talk about our fears. Let's talk about our concerns about taking the vaccine, why we would, why we wouldn't. And I think the more we talk about this, the more people will become more comfortable with it. The more people can really have their questions answered, things that may stop them from taking the vaccine, and feel more confident in the science, and that they'll learn that, and people will come to know that this is working. Prevention is the only way really that we can get over this virus. So I just encourage people to keep talking, talk to your family members, your friends, your doctors, and if you can, and if you're willing, please take the vaccine. If not for yourself, then for others.
Well, I want to say enthusiastically and gratefully, thank you so much to you, Dr. Lee Vaughn, and to you, Dr. Stacey Mary Taylor, for giving of your time and expertise to help our listening and congregational audience. We so much appreciate the fact that you are, I believe, here for such a time as this. I think you've been extremely helpful, and we are extremely grateful. And we look forward to continuing contact with you. And we thank you so much for being with us on this evening. And so with that, we want to thank all of you who have tuned in this evening to be with us and to share in this program. And prayerfully, you have been helped as well. And please do take to heart the advice that you have heard and you have been given by these experts who work in this field and on this subject every single day. We bring it to you to make your life better. We bring it to you to make your life better. Our life study this evening has been about making your life better and giving you the information with which to make decisions that will benefit you, especially in the arena of health. And so we thank you, and we ask you, and we thank you also for your generous contributions to the sustenance of this ministry. And we ask you to pay attention to the announcements that will now scroll at the end of the broadcast. And we look forward to seeing you by Zoom this coming Sunday at 9:30 a.m. for our worship service. This is our Christmas Sunday. We celebrate Christmas on this coming Sunday. Thank you. Be safe, be blessed, and we'll see you Sunday morning.